to determine staffing, acuities, and patient rationales. In order to find the correlation between the nursing strategy or the nursing shortage, the Cox proportional hazard regression model was utilized. This model is used to determine the effects of the variables over a span of time, and the results should show a linear relationship or a linear line. So you can see the results in it. And that came from MedCal of 2016. A possible association could be linked with high mortality rates and readmission rates with this regression model. And in conclusion, on this review article, the hypothesis was deemed correct. There is a correlation between readmission rates and nursing staffing. Adverse events such as the deaths increase when staffing is not adequate and the hazards ratio is below target staff. This is from Needleman and others of 2011. There has to be adequate staffing in order to deliver proper care for patients. If the staffing is below target, negative outcomes occur. Since there is a positive correlation between readmissions and high mortality rates as well, due to understaffed, the researchers want to reject the null hypothesis because the variables are associated with one another. There are strengths and weaknesses in this very well in the literature. The weaknesses were there was no care model, and I had to come up with my own to underpin the study. And also, researchers did not think about the structure of the units, the staffs, or other nurses as well, such as LPNs or the licensed vocational nurses. And the strengths was there was a direct correlation with high mortality rates and readmission rates as well. The second article that I used was conducted by Sachet, Scalzi, and Jawad of 2003. And the research design was like the first of the literature piece. It was a retrospective observational study. Like several professions, healthcare has experienced some setbacks as well due to budget cuts and lack of staff. My problem statement would be there are negative outcomes that are the results of inadequate nurse staffing. The unit managers or the clinical directors need to take into consideration the number of years that you've been a nurse, the nurse-patient ratios, the budget cuts, and the number of the number of nurses with higher nursing degrees, and the complexity of each nurse and the budgeting process. It takes a lot to manage a hospital unit, but oftentimes patients or families shouldn't hear the statement, "Sorry, we're short-handed." This should never be used because this is unacceptable. Today, shortages can lead to adverse events such as falls, med errors, and even death. I had a chance to round with one of the prestigious nurses at Magnolia Regional Health Center, and her name was Ruth Ann Johnson. She is one of the assistant administrators of Magnolia. I had a chance to shadow her and figure out how it is that staffing and the budget tie hand in hand. I had a chance to go to each unit, and I had to calculate the staffing matrix for each patient based on the complexity, based on the acuity, and the ratios as well as nurses too. So the research question is there a correlation between the budget cuts, the nursing inexperience, and the lower level of education due to the increased mortality rates, along with the nursing shortage as well? Also, it's hypothesized that the budget cuts, the nursing inexperience,